Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to talk about this great article in the most recent People magazine that profiles 6 people and their journeys with GLP-1 medications. Overall, I really liked the article. I felt like it was realistic and gave wonderful and personal perspectives about the medication. However, there are a few things that I'd like to comment on. First of all, I'd like to say, though, that for these 6 people to open up their lives and be so vulnerable and honest about their weight loss journey, I think is really remarkable, and I'm so thankful for them. I love that we're continuing to have conversations about obesity and the disease of obesity. As I mentioned, there were 6 people profiled in the article, and the first 2 profiled were 2 women about the same age. One was 46 and one was 48, and it was very sweet to hear them talk about how they have developed a deep friendship. The first patient has lost about 118 pounds over the past 2 years using Mounjaro. My assumption is that she may have had type 2 diabetes initially and was started on Mounjaro at that time, because Mounjaro really is for type 2 diabetes. The next profile is a 48-year-old female, and she's lost 114 pounds using Mounjaro and Wegovy. It's interesting, she probably was started on Mounjaro under the diagnosis of impaired fasting glucose or pre-diabetes, but then once insurance qualifications changed, she was switched to Wegovy by her doctor. And unfortunately, she says now that her insurance is no longer covering Wegovy, which is very common. And so she is transitioning off her GLP-1 and using other anti-obesity medications, most likely something like Qsymia or Contrave or phentermine or bupropion. The older oral medications are fine. I actually use them as an adjunct occasionally with GLP-1 medications, but she's not going to have the same robust benefits that we see with GLP-1s, including the anti-inflammatory effects and the lessening of food noise. So while I understand her need financially to switch to another medication besides a GLP-1, I'm saddened by the fact that her insurance doesn't see the value of this particular patient who's lost so much weight and has made incredible strides for her health. The third profile was interesting. It was a 19-year-old female. She was initially placed on metformin for polycystic ovarian syndrome, and metformin sometimes can help patients lose some weight. Occasionally, it's the missing link and patients lose a lot of weight on it, but most of the time, it's either weight neutral or maybe just a few pounds. She didn't see much effect with the metformin, so her doctor switched her to Ozempic, most likely under prediabetes or metabolic syndrome diagnosis. And after starting the Ozempic, over 8 months, she lost 150 pounds, which is remarkable. But this past August, her insurance declined, continuing to cover Ozempic, likely for the diagnosis of metabolic syndrome or prediabetes, and she's now gained 50 pounds back of the weight that she's lost. Another heartbreaking story that can be just so difficult on people's emotional health. I would strongly encourage this patient to consider using compounded GLP-1 medications from a reputable, reliable source in order to continue her weight loss journey and keep that weight off. The yo-yoing up and down of the weight is not great. And she mentioned that she really hopes to continue to keep the weight off with diet, exercise, and healthy habits. And that's just really, really difficult to do because, as we're learning, obesity is not a disease of moral failure. It's not a disease of laziness. It's not a disease of willpower. The next 2 profiles were a husband and wife duo. She's lost 75 pounds and he's lost 102 pounds. It sounds like they've both been using Zepbound, which I'm thrilled about. That means that if they are on Zepbound, their insurance most likely covers anti-obesity medications. And the last profile is a 38-year-old female who has been using Ozempic, I'm assuming for type 2 diabetes diagnosis. So I'm finding that Ozempic is no longer being covered for a diagnosis of impaired fasting glucose or pre-diabetes. She mentions that she doesn't expect to be on the medications long term, but if that's needed to keep her healthy, then it sounds like she's open to that. And I would just continue to state and remind people that if you lost weight with a GLP-1 medication, you need to stay on the GLP-1 medication in some form to keep the weight off. Patients really push me to go off the medication. We'll have a conversation about it, and I'll say, maybe go to every 10 days and see how you do. Maybe let's go down on the strength of the medication. Maybe let's go down to every 2 weeks on the lowest strength and see how you do. I just wouldn't completely stop it. If they're bound and determined to do that, I say, okay, you can go off of it, but I want you to weigh yourself very frequently. And if you start to see any amount of weight gain, 5, 10 pounds, I need you to come back and we're going to have a conversation about putting you back on the GLP-1 medication at that point. But I also want to talk about the beneficial side effects that a lot of these people talked about. They talked about no longer needing pain medication like ibuprofen and Tylenol for back pain and knee pain. They talked about less food noise, a different relationship with food. They talked about not drinking as much alcohol. They talked about just the increased ability to interact with family and friends. However, they also did meaningfully talk about negative side effects. Sulfur burps were mentioned. Constipation and nausea are just really two of the big ones that I hear a lot about. And the loss of muscle. The loss of muscle isn't specific to GLP-1 medications, it's just specific to weight loss in general. At the end of the day, I thought this article was well written. I'm really saddened when I hear that insurance companies cut patients off after having so much success with the GLP-1 medications. And I hope that that will continue to lessen in the future as we continue to see and show to insurance companies the beneficial effects of these medications. If you've had experience with a GLP-1 medication, I'd love to hear about it in the comments below. Thanks for joining me.